So my name is Emma Nieminen. I work for the Nightline Association currently as the Suicide Calls Project Coordinator. I've been in this role since December. It's a fixed term contract to work on rolling out our new bespoke suicide calls training to our affiliate Nightlines, which there are 39 across the UK and Ireland at the moment. So obviously, because the main brunt of my work is kind of facilitating and administering this training, the nature of our work has massively changed as a result of COVID-19. We obviously aren't able to go out and deliver this training, and it can't really be done in a virtual environment at the moment. So we're really trying to think creatively about what we can do to still further this project while we're not actually able to carry out our training. So we're looking at a lot of things like suicide postvention and how to basically respond to the feedback that we're getting from our Nightlines in terms of what they find difficult when it comes to handling suicide calls, and overall just how to respond to what Nightlines are actually asking us for in the current climate. I think a pretty good example of how we've been flexible and adapted due to the current situation is that we would normally have an in-person spring conference in April of each year. This is for up to 100 Nightline delegates, plus loads of our association volunteers as well. And in the space of about 5 weeks, we turned this whole conference around from being an in-person event to more of a virtual one. We ran this last weekend, and I want to say that it was a massive success. So I think that's probably a really good example of how you can just pull something out of the bag a lot quicker than we thought we could have. I think the content that we managed to still pull off was really engaging. We've got some really great feedback from Nightlines, and I think that's really what's going to shape the work of the Suicide Calls project, but overall the work of the Nightline Association going forward, especially into the summer months when universities are shut. So hopefully, there's lots of little bits and pieces for us to pick up on from there. So that's kind of a roundup of what we've been working on recently and how we've adapted to the current situation.
Great. So I'm Naomi Wilkinson. I'm Senior Commissioning Editor at Epigeum, which is part of Oxford University Press. So we create online courses for universities. One particular program I've been working on is our online wellbeing toolkit for students, Being Well, Living Well, which we've been developing over the last year or so. In collaboration with universities, students and experts like Nightline. It's something that's obviously been in the pipeline for a while, responding to kind of a lot of need for extra wellbeing resources for students at universities. Obviously, as part of kind of the current pandemic and the restrictions that everybody's under, we've had to think about different ways of working. So whereas we would usually go into universities and film students to include in the modules themselves, we're adapting so that we're getting some students to actually self-film, so that we'll be liaising with them online and getting them to send us footage of themselves talking about their individual wellbeing experiences. Because obviously it's still really important to make sure we have that student engagement. And also just being a bit more understanding of people's kind of needs and their current situation, and being a bit more understanding in terms of deadlines, giving our reviewers from universities extra time to actually deal with their other priorities right now. And beyond the wellbeing toolkit, we've also been looking as a company at kind of other areas that we can support universities at this time. So providing some free access to some of our courses around how to teach online effectively, and things like that. So we can give them as much support as we can at this time.
So Naomi, one of the questions that's been collated from students as part of the Think Positive project is, how do we best signpost students for support?
So I think the important aspects are ease of access and use, and ideally tailored to students specifically where possible. So for example, in the wellbeing toolkit that we're putting together at the moment, the modules are all designed specifically for university students. So the approach we've taken with that is that it can be used as a preventative tool, so it's aimed at all university students, so everybody has access to some kind of baseline support through the modules that are really kind of holistic coverage of all angles of wellbeing while at university, or it can be used by students at specific times of need. So there's a really interactive approach. They can go in to develop skills and individual strategies, and so for some students that might be enough, but for other students they'll be identifying areas actually they do need some further professional support perhaps, and that's where the signposting in our modules will come in, and that's at various points throughout each of the modules, as well as in a full resource bank at the end of each of the modules. So it's important to link through to external organisations, but also information about what services the universities themselves can offer. And we've created opportunities for universities to customise that themselves, so they can put in specific detail about, you know, what particular contacts, you know, when appointments can be made, what time services are open, for example. And importantly also peer support. So we've included peer support as a key element of the programme as well, to give them practical tips and advice on how to open up those conversations with their friends, because we know that students are more likely to turn to their friends first before they seek other support. So it's giving them the tools to be able to deal with those conversations, but also the understanding of when and where to point their friends in direction of further support, and giving them that confidence to deal with that, and of course as well as giving them some self-care tips and knowing the limit of their role as a peer supporter. So yeah, it's kind of giving students overall easy access to all the information, all the baseline information they need, with points that they can then go off to more specific or tailored kind of support for their needs.
Yeah, I think that's my favorite thing about having worked on the Epigeum kind of project, is seeing how tailored to students it is. I think there's such a power in that a lot of other, you know, commonly signposted resources don't necessarily have. So the fact that it's so specific to students and what they're going through, and the fact that it is so accessible, I think that's what's really going to make it such a successful tool.
And I think a lot of that's come from the collaborative approach that we've taken. So obviously we involved universities very early on in the process, so they helped to shape the modules and make sure it really met their needs. But also we had student reviewers, we've involved Nightline, had lots of expert reviewers commenting all the way along. So it's really making sure that it meets universities' needs, but also it's at the right level for students, and yeah, it gives them something practical to take away.
Yeah, I think in answering this question as well, I had pretty much the same points as you, in that it needs to be accessible, but the support should also be, I guess, varied, acknowledging that, you know, one size doesn't necessarily fit all when it comes to support, or, you know, any kind of mental health signposting. And I think that's where, you know, your tool is really excellent at doing that, because it has such a variety of tools and exercises in there, and it signposts to a lot of, you know, different places where you can get support as well. So that variety, I think, is really going to make sure that there's something for everyone, and that it's accessible in a lot of different formats.
Yeah, absolutely. And I think overall for universities, it's part of, you know, they have to have that array of resources that will suit different students at different times. Obviously, certainly at this point in time, that, you know, there's going to be a lot of focus on online, also telephone support. You know, hotlines are going to be really important for students right now without that face-to-face access. So.
And I think that's where we've had to make quite a lot of changes as well to our individual Nightline services. So most of them, when their universities shut campuses, they weren't able to be on the phone lines anymore to actually accept phone calls from students. But they've adapted their practices quite a lot to now either set up instant messaging services or email services if they didn't have them before, or have adapted their operating procedures to make sure that that can be done safely in a remote way. And I think it's tools like that that are really, really important just now. But I guess what I thought of as well with this question is, even beyond the current situation that we're in, beyond the pandemic, what's the best way for us to actually signpost overall to students? And those same points still came up for me, that it needs to be accessible, it needs to be varied for lots of different students, but it should also be joined up. And I think that's where a lot of institutions struggle to have a common message, or one point from which you can find lots of different resources that any particular institution has. I think, like you're saying, that institutions who use the Epigeum toolkit, they're able to customize that so that they have their own list of resources that their students can access. And I think that's quite a rare thing for institutions to actually have, is one place with all the bits and pieces that a student might need and can then choose from there. And I think that's one of the things that I would certainly like to see institutions responding to the current situation now, but especially afterwards.
Yeah, I think also it's about making sure that companies like us that develop these resources to help universities also bear in mind that we need to be flexible in our approach as well, so that it can be adaptable for universities to fit in with their current systems. It's not always easy for a university to change a whole system or the way their resources are set up. So it's working together collaboratively that I think is the key.
Absolutely. I felt good. Yeah. Definitely. That sounds really exciting. And I can see so much of I've just loved working on the being well, living well resources and things. And it's really exciting to hear your take on it as well. And just, yeah.
Yeah, well, it's been just so great having everybody's feedback, and everybody's so engaged and positive, and actually in particular the students, they've been fantastic and really engaged, and they really know what they're talking about as well. So yeah, it's fantastic. All right, so how do we prepare for the long-term impact that COVID-19 will have on the next year or so?
A really, really good question. One that I thought about for quite a while. And I actually simplified my answer to 3 simple words that I'm going to try to maybe expand on a little bit to kind of say why those were the ones that stood out to me. And those 3 words are acknowledge, ask, and adapt. Surprisingly, they all fit in with the A letter theme, which worked out quite well. But I think the first thing in terms of long-term impact is acknowledging that there has been an impact. And that's institutions, that's students, that's everyone across the board acknowledging that things are different. I think there's probably quite a lot of impact on individuals' mental health already, let alone if we're talking about the long-term impact, potential PTSD, agoraphobia, anything that has been impacted and influenced by this current situation. And I think it's acknowledging that is the situation, that a lot of people will have been impacted in quite a lot of ways, whether they be traumatic or not, and that has to be reflected in how we're responding to mental health after this initial kind of lockdown and pandemic situation is over. And I think the way to react to that is to ask, as in asking students, what is it that you need support with now? It might be that, the first things that people are worried about are the very practical things, their housing, their finances, where they're at in the progression of their degrees, their courses, how all of that will be affected. or their number one concern might be mental health, and we won't know that unless we ask. So I think asking those questions to as many students, to as many people as possible, and finding out what are the things that they're struggling with right now, in a month's time, in 3 months' time, in a year's time, that's how we're going to find out what it is that we need to be actually responding with. And I think that's where we need to learn how to adapt. I think we're already doing it, sometimes in big ways, sometimes in small ways, but adapting to our services and the resources that we're able to offer to actually meet that need, once we found out what that need is, I think that's really how we're going to, I guess, deal with the long-term effects in as effective and sustainable way as we possibly can.
Yeah, I agree, definitely. And I guess it's about just keeping those conversations open and the communication going. And as you say, it's not just everybody's reacting now to put new things in place right now, but they're not necessarily the perfect solutions at this point. So it's kind of adapting them as you go along.
Yeah. And I think there's a lot of suppositions that we can make at this point about the potential impacts. And I think that's important to try to plan ahead already in terms of what we might need to do. But I think it's continually asking those questions. Like we had at our Nightline conference this past weekend, we acknowledged that actually this next academic year's freshers might have a very different university experience than those in years before. A lot of them might not have sat their high years. They might be entering university in a very different way than they usually would have. And what's that going to look like in terms of their mental health? We might have a much greater incidence of imposter syndrome, of people not really feeling like they've deserved their spot, and these are just things that we're kind of pulling out of the hat and possibly thinking about now. We won't know if that actually is the case until we get to that point and actually ask students how this situation has impacted them and what's the best way for us to support them at that point in time. And I think that's where that really joined up institutional approach comes in as well, is that once we've asked those questions, it shouldn't be a million different teams running around doing different things to support their students. I would really hope and do hope that we can see some kind of joined strategy for how to deal with that on a very holistic level, taking into consideration the actual institutions, student unions, volunteering groups, whatever it is, but kind of all working together to try to meet that need.
Yeah, absolutely.
Grand. Right, I'm going to uncross my legs. And we'll do question 3. Grand. So how do we support the students that we might not have had contact with previously?
So I think it's important for universities to make students aware of the support service available to them and to help them understand or decide which would be the most appropriate for their needs. So for some students, for example, they might be reluctant to seek help, or perhaps students with lower level needs. And so an online toolkit that they can complete in their own time, in their own privacy, might be ideal for those students. But for others, they might need to be signposted to professional services, or they may benefit from speaking to someone on the phone. So at this time, it's even more important to have a collaborative approach in universities. So between academic and support staff working together to make sure that all students receive the support that they need. So I think ultimately it's about communication. So whether it's communicating via the website, through emails or on social media, and adapting the message to suit that method of communication. So for example, our lead advisor, Dom Thompson, recently adapted some of the self-care tips we had in the toolkit so that we could share them with students on social media. So it's something that can be easily shared, quickly digested by students. So it's all about finding different ways to engage, I think.
Definitely. Cool. I'm feeling a follow-up question. Is that okay?
Yeah.
Like, I guess because we've been talking about like what we have been working on and how we're adapting to this current situation. I kind of just want to ask, like, what's next for Epigeum? You know, where are you going with the project next, and what are the next steps? Would that be okay?
Yeah, absolutely. So, I mean, generally, there are a few areas that we're working on. One of the things I'm looking into at the moment is how we can better support international students. This is something that I was looking into at the beginning of this year, in any case. However, obviously, you know, there's a completely different dimension put on it now. You know, there's such uncertainty about international students, you know, at what point will borders be open, for example. But beyond that, you know, how easy is it going to be for international students to, you know, come back to universities in this country or elsewhere? So it's about looking into international students' needs specifically, and how we can support those, because they are quite different wellbeing needs and academic needs to domestic students. So as much as we cover that a little bit, our wellbeing toolkit is relevant to international students. There's a lot more that we could be doing for them as well. But also, I think there's definitely some work to be done around looking into how we can better support students with online learning or remote learning, especially though, you know, they've suddenly been thrust into this situation at the moment, where they're having to deal with, you know, completely new ways and unexpected ways of having to work. So, you know, how can we better support students and the universities in doing that?
Yeah, I think it's a very similar kind of outlook for what we're hoping to do with the Nightline Association as well. You know, we've already been supporting our affiliate Nightlines with setting up remote instant messaging services, email services, and providing them with the right guidance to do that. So that's been the first hurdle, I think, in terms of amending our services. But I think going forward, it is trying to work collaboratively, exactly like you said, to find out how these intermediate measures are working for them, whether there's any further support that they need in order to be able to support the students at each individual Nightline level, and then continuing to listen to, I think, what it is that they're struggling with, or where they need further support in order to still run a thriving service while we are still in lockdown and things aren't quite back to normal. So I think that's kind of what we're looking to do as well. We've got lots of feedback from last weekend's conference that I think we'll be able to action in the coming months. So I think we have quite a lot of ideas as to where we can go next already.
Yeah, that sounds good. And it's just so important, isn't it, to keep going with that support?
Yeah, definitely. And I'm so excited to see the Epigeum project kind of come to life, and yeah, it's been a really amazing project to work on, so it's exciting to see it come.
That's great to hear, and yeah, we're all excited for it to come out soon, so yeah, watch this space.